Imagine you're 7, lying in bed, and suddenly your bedroom door shrinks to a postage stamp. Your mother's humming becomes a deafening roar. Your hands swell into giant balloons. This isn't a dream, it's Alice in Wonderland Syndrome, or AIWS. It's a neurological glitch that distorts how you perceive reality. The name comes from Lewis Carroll's story, where Alice grows and shrinks in a world that defies logic. For those with AIWS, everyday objects, even their own bodies, can appear bizarrely distorted. These episodes can last minutes or up to an hour, striking without warning. For a child or adult, it's isolating and confusing. The first step is to listen. These are real neurological events, not fantasy. Think of your brain as a computer. With AIWS, the software that processes size, distance, and time glitches. The journey into Wonderland is just beginning, but understanding is possible, and it starts with awareness. Let's step further through the looking glass. During an AIWS episode, the world becomes a funhouse mirror. The most common symptom is visual distortion. Objects look too big, too small, or oddly shaped. Faces might stretch or melt, a TV might seem to tip over, and your own body can feel alien. You might feel your legs are miles long, or your head has shrunk. Some people feel as if they're floating, or that their limbs don't belong to them. Time can warp. Seconds feel like hours, or hours pass in a blink. Sounds may become painfully loud or strangely muffled. It's a full-body, multi-sensory experience, as if your brain's orchestra is playing out of sync. Importantly, people with AIWs know these perceptions aren't real. They have insight. It's not psychosis, it's a perceptual glitch. The real challenge is the fear and confusion these episodes cause. Losing control over your senses is deeply unsettling, but understanding the symptoms is the first step to managing them. AIWS is a reminder of how much we depend on our senses to connect with the world. Next, let's explore what causes this strange condition. Why does AIWS happen? There's no single answer. AIWS is a collection of symptoms triggered by different conditions. Migraines are a common cause, especially in adults. AIWS can be part of a migraine's aura. In children, infections like Epstein-Barr virus, which causes mono, are frequent triggers. Other infections, tonsillitis, flu, Lyme disease, can also lead to AIWS. The body's immune response may temporarily disrupt the brain's sensory processing. The good news, when the infection clears, AIWS usually disappears. Less commonly, epilepsy, brain tumors, strokes, or certain medications can trigger AIWS. Because causes vary, anyone experiencing these symptoms should see a doctor. AIWS is a signal from your brain that needs investigation. It's not just a weird experience, it's a clue to something deeper. Next, how do doctors diagnose this mysterious syndrome? Let's find out. Diagnosing AIWS is a process of elimination. There's no single test. Doctors start by listening carefully to the patient's story and taking a detailed medical history. A neurological exam checks vision, balance, and reflexes for signs of other problems. If infection is suspected, that may be enough for diagnosis, especially in children. To rule out epilepsy, doctors may order an EEG to check brain activity. If symptoms are new in adults or there are other concerns, an MRI scan may be done to look for tumors or strokes. A clear MRI and normal EEG help confirm AIWs and rule out more serious conditions. Once other causes are excluded, the diagnosis is made. The key is taking symptoms seriously and investigating thoroughly. With a diagnosis, the path to management becomes clearer. So what can be done for those living with AIWS? There's no cure for AIWS itself. Treatment targets the underlying cause. If migraines are the trigger, managing migraines is key, through lifestyle changes or medication. If infection is the cause, treating the infection usually resolves AIWs. For children, knowing the syndrome is temporary can be reassuring. During episodes, reassurance and a calm environment help ease fear. For adults, relaxation techniques and mindfulness can reduce anxiety. Most people, especially children, outgrow AIWS. For adults, it can be managed alongside migraines. The most important message, you're not alone, and you're not losing your mind. With understanding and support, the world returns to normal. The brain is mysterious, but hope and knowledge light the way.